Hey guys!
Hey, what's going on?
So we are headed into our fertility clinic. They've been so kind to just let us get a tour of the facility, so here we are.
Alright, so let's go. Let's take a look at it. Fertility Institute of Hawaii.
We've already gone through the rooms with one of the nurses. We did a little quick run through, so we are going to show you how it looks like. Okay, so here we are in one of the exam rooms. Very familiar because this is where I had my saline sono histogram. They also do their IUIs in this room as well. And check it out. A more modern ultrasound machine. 3D to be exact. This is my favorite spot ever.
Why? You like to get stuck with needles?
I like to get stuck. What? And this is my girl, Zoe. She's the best. Only takes one time to stick me. Don't even feel anything.
Awesome. Have a seat.
This is where we go for our lab draws right over here. We get this cool little sperm right here to get those veins nice and plump.
And if you're scared of needles, we have either the picture on this wall or our beautiful window to look outside.
We get to look at all the Hawaii traffic right here in Keeaumoku. No. Plus Zoe's the one that recommended that Jan barbecue spot.
Yummy. So yummy.
This is the room where they hold their consults. So behind you, you'll see the IVF lab. That's probably where they're storing June's babies.
My sperms are stored in there, frozen. So we're in the collection room. On this particular day, the girls come in for their egg retrieval, and then the guys are gonna come here to give their sample of their sperm. So we've got this couch behind me. We've got a TV, and when you're done, you put it right in here in the little collection window. So right from the collection room, it goes from this little window right over here, right under the microscope, and they can see right over here. Okay, so this next section we're going to is kind of the area where patients are prepped to go into their procedures. So we're going to go ahead and relax over here, and then once we're ready to go, we're going to go into the operating room, and that's where they're going to do your egg retrievals, your embryo transfers, and then you'll come back here afterwards.
I'll be here soon, within the next 2 months.
And she's gonna have an embryo in her. Okay, so we're over here at our doctor's office now. This is Dr. Frattarelli.
Hello.
We're just gonna ask him a few questions in regards to IVF and just kind of what we can expect for our procedure here. For those that don't know, can you just explain a little bit about what IVF is?
Sure. Well, first of all, thanks for asking me. IVF in general is used for patients who may have trouble conceiving naturally. Normally what happens is you will give patients medications. Injectable medications are usually what we use. You take the injectable medications for approximately 2 weeks. After about 2 weeks, we will take the eggs. We'll get eggs. We will get sperm that day, fertilize the eggs, let the embryos grow in the laboratory for approximately 5 days or so. And then several things can happen at that point. We can either do a transfer, we place embryos into the uterus, or we could potentially freeze embryos for future use, or even do genetic testing on embryos at that time.
So you haven't seen us too much posting fertility videos because at this time we're waiting for our PGD probe to be built. That's the holdup here, but let me have Dr. Frattarelli tell you about PGD and PGS.
Certainly. So PGD, PGS have been around for a long time, but they're constantly evolving. What PGS is, it's pre-implantation genetic screening. So what happens is we get an embryo, we can take some of the cells that would normally make the placenta, and we can test the embryo. And in doing PGS, or pre-implantation genetic screening, we're basically looking to see if the karyotype of that embryo is normal. What a karyotype is, it's basically the chromosomal makeup of the embryo. And we're all made up of 23 pairs of chromosomes, actually 22 autosomes, and then the sex chromosomes, which would be 2 X's for a female or an X and a Y for a male. And so The chromosomal analysis is just making sure that everything's paired up appropriately, that you have 2 of everything. If you're missing a chromosome or you have an extra chromosome, that typically doesn't work in favor of having a live birth. The one exception would be Down syndrome, so an extra chromosome 21 could lead to a Down's baby. But most chromosomal abnormalities are going to cause miscarriages or not create a pregnancy. PGD differs a little bit in this pre-implantation genetic diagnosis. That comes into effect when a patient has a specific gene that might be abnormal. The reality is we all have genetic errors, okay? But if 2 partners, if you're linking up an egg and a sperm with the same genetic error, then you can have a baby that would be affected. For instance, like cystic fibrosis, Tay-Sachs disease, thalassemia. You know, those are genetic disorders where if the egg and the female both have a gene that's abnormal, the baby can be affected, whereas the parent may not be affected because they're just a carrier. And so with pre-implantation genetic diagnosis, we do the same thing that we do for PGS. We take a little sample of the cells that would make up the placenta from the embryo, but then they actually, instead of just making sure the chromosomes are there, they have to build a special probe. It takes a couple of months, but they build a special probe, and then they can look and make sure that that embryo doesn't have that gene. And then we can use that embryo if it's not going to be an affected embryo that would create potentially create a baby that would be affected with that disorder.
What do you think would be a good candidate for that test? Is it like someone that has had like previous miscarriages, or like, is there an age range?
Yeah, so for PGS, for pre-implantation genetic screening, I think everybody's a good candidate. Because we all make abnormal embryos. Once the sperm and the egg fertilize, the amount of embryos that are abnormal is much higher than you think. Even in your 20s, about a third to a half of your embryos that you make are going to be abnormal. So if you do PGS, you're able to pick out those embryos. When you get into your 40s, it's 80 to 90% of your embryos are abnormal. So PGS is really good for pretty much everybody. PGD is different. PGD really is only used for patients, again, if they both share the same gene, and so potentially you're just trying to find that genetic error so that you're not propagating a child that might actually have a genetic disorder.
So on the day of the egg retrieval, what can we look forward to?
With the egg retrieval day, basically there's that lead-up period, and then we're ready to get the eggs. And so you'll be given a lot of instructions about what to do. But the key thing is when the female comes in for the egg retrieval, one of the key things is she can't have anything to eat or drink for about 8 hours prior to coming in because she's going to get anesthesia in order for us to get the eggs out. And the reason we have to give anesthesia is because we typically have to stick the ovary with a needle multiple times in order to get the eggs, and that would be very uncomfortable if someone were awake. So we do give anesthesia, we get eggs that day. You're here for a couple hours, not very long. Afterwards, you guys will go home. Because of the anesthesia, it'd be a little bit groggy, a little bit of uncomfortable just because the ovaries are big and tender, but typically not a lot of pain. Most of the time, there's not a lot of nausea or anything like that you would normally expect after regular anesthesia, because the amount of anesthesia we use is very minimal. It's a 10-minute procedure, so it's a very low dose, and so patients do very well. But that one day may be a little bit groggy and a little bit uncomfortable, but should be very minimal.
Can you let us know about the services you provide here?
We really provide a whole range of infertility services and some GYN services as well, but mainly infertility services. So whatever the infertility needs are of the patient, we can help manage. And that goes from just doing diagnostic workup and diagnostic tests, and sometimes it's just a matter of giving people instructions as to what they're not doing right, timing intercourse appropriately because maybe when they thought they were ovulating they weren't. And then other times it's actually doing some evaluation and maybe surgical treatment to fix problems that might be occurring, or medical treatment. And medical treatment can start with just oral medicine. It can involve IUIs or artificial insemination where we place sperm into the uterus, or even up to IVF, and further after that you can do donor eggs or gestational carriers. There's really a wide range of things depending on what the individual patient needs.
Well, we just want to thank Dr. Frattarelli here for giving us an opportunity to come here and ask him questions and tour the facility.
Thank you guys.
All right, we're all done.
Yep, we're all done. We just wanted to thank Terry, Robin, Dr. Frattarelli, Zoe, and all the other girls for you know, arranging this tour for us.
Giving us the opportunity to walk around, kind of tour the facility, and let you guys take a look at what we're going to be going through here.
So if any of you in Hawaii are looking for a fertility specialist, check Dr. Frattarelli out. Check SART, and you can see how high his success rates are.
All right, bye guys.